Alright, so you each get one of these kits. So when you go to open it, you can write your name right here. And you each get a needle to practice with. I think, no, I'm just talking a little. I don't. You're gonna drop this into here after you use it. Yeah, I know you shouldn't make out needles, but you can, you know, kind of guide it on and don't stack yourself. But if you pull it back, it'll lock and you'll have to get it open. When you access port class, you technically want to put your patient in 10 degrees of Trendelenburg. So which way is their head gonna be? Good job. Hold on.
His face looks symmetrical.
She says how often you guys are
He doesn't have any abrasions or anything like that. So
You know, like that, like go to the movie theater, or like, what is it? No, it's like a.
I'd only been to one ever. It's the most annoying thing ever. It's usually like 20 times.
Like a whisper, and it's like in the commercials, like right over the movie, and I don't remember what it is.
If you wouldn't have said like whispers.
It's ridiculous.
11. My sister, like that's it, no, Nuremberg. We went to a movie theater and they said Nuremberg and then they cut it down.
Really?
Yeah, apparently it used to be more than.
And still kind of outrageous.
I'm going to go ahead and reposition him. That way he doesn't get any. So we're repositioning as well.
Which is great. I'm gonna go home and do something.
Great one.
Sorry.
You can just give her a chair. That one right
She said
there.
what?
Oh, Carrie just showed up.
Awesome. I'm glad you went ahead and did that.
No, you're supposed to be on the other side. Okay, so we're gonna put our patient in Trendelenburg, okay? And when we go to we're gonna talk about different access points. This patient has a normal little healthy IV right here that we put in. They have a PICC line. We'll talk about that in a minute. PICC line. They have a central lumen catheter device. And they also have a Broviac. And all the PowerPoint part is uploaded and you can listen to my great voice. It's one of the very first ones I did, so obviously I think I got better over time, but just be aware of that. So, okay. So, the first thing we're going to talk, oh, and he has a portacath. It's flipped around. Good thing I'm going to perform some surgery.
Portacath?
Yeah. Okay. So, the first thing we're going to talk about is how to put a dressing on a central line. These are placed typically at the bedside. I'll take this out and pass it around. I posted a video for you guys to watch. They can go in the subclavian, they can go in the jugular, and they can go in the femoral. They come in a kit that the surgeon places, not the surgeon or a physician, like the ER docs put them in. Some of the ICU docs put them in. Yeah. So if you look at this when I pass it around, it tells you the gauge of the size. You want the distal is the largest port, so you want to draw most of your blood from the distal end. And sometimes one may not give blood for some odd reason, so be aware of that. When they're put in, they don't have these cute little caps. They're a little different at the hospital, but this, oh, there, it came off. It'll come like this. You're gonna add these little caps after they place it with a saline syringe and push saline through. And then once they put them in, we usually use an ultrasound machine. And then they're sutured in place and held in place by a tegaderm. Does that make sense to you all? That's okay. I'll pass this around. After you graduate, you'll be taught how to remove them when you go practice somewhere. We don't expect you to know that. You have to take a special class. So, but when you take it out, you want to make sure this tip is intact. There's like usually a blue tip. If they think the source of infection is from the central line, they'll want you to do a culture of the blue tip. So when you go to cut right here, do you think you cut with your normal scissors, bandage scissors you keep in your pocket? Or should you use sterile scissors like Katrinka already answered? Good job. Okay.
Their lung collapse.
No, then it was in there.
So when we have all these central line access devices, besides our little peripheral one, we know that doesn't lay, they all end up laying in the superior vena cava.
All of what lays?
They all like end up laying in the superior vena cava of the heart, the tips. They mostly refer to the triple lumen catheter as a central line. So just be aware of that. And we'll talk about how to clean the skin, prepare the skin. When our patient has a PICC line, these are mainly put, don't come in and then go in there. You're fine. When we talk about a PICC line, we need to measure the distance that it's showing, and we need to measure in centimeters. Because when would you see a notice of difference faster, in centimeters or inches? Centimeters, because that's smaller numbers. And so you're gonna measure the distance of exposed, because sometimes they like to migrate or travel and more is exposed. Does that make sense to you? And then the next thing, you're gonna measure 10 centimeters above the antecubital fossa space, the AC space. If you're a good nurse, you're gonna mark it with a skid marker, so everybody's measuring at the same place. That's what I do, and that's what a lot of the nurses do. Because then if it's any of this has moved and fluid's building up, say it's shifted and it's laying here instead of up here where it should lay, we know that it's not in the right place and there's swelling there, so the fluid's going to the wrong place.
What's that spot called again?
The antecubital fossa, or the AC space. Right, ER nurses love to put IVs and make the floor mad. Shelby, can I grab that from you, or do you guys need to look at it still? You see it? All right, so today, the patient, this is sutured in, sorry. This is sutured in, and the patient ripped off the dressing. Great day for us. If you're going to take a dressing off though, you're going to pull up, up and away. Excuse me, pardon. Sorry. That's okay. Because as you pull up, up and away, you're gonna pull up, up and away, and it's not gonna come out. If you pull down, the line will come out with you. Does that make sense? Okay, so I'm going to open my kit, and you open away, and then what? Side to side. And I hold the side and like the top together, and the side and the bottom together, and that makes everybody great. Oh no. And now because we're gonna do this, we're gonna have our patient wear a mask so they don't breathe on it. And I'm going to wear a mask. And I have a really bad cold and I'm not gonna put it over my nose and face. So for the video, you're gonna wear it like this and you'll check off unless you're gonna start feeling claustrophobic. Okay, step one, you're gonna grab this. And they're in Trendelenburg. Is that on your video? I don't know if it is. Just wanted to make sure. You're gonna lay that towel over them. You're not gonna turn your back on your sterile field. You're gonna open your gloves. Great. And for later in life, for your final NCLEX skills lab test, do you put your dominant glove on first or your other one?
I think it should be your dominant.
That's right. Okay. So, these kits that we have here, like the Handle Clinic ones, when you go to the cancer center, they have these nice pre-filled syringes. So, which we don't need those yet, but we'll talk about it. Okay, so we're gonna have our mask on. We're gonna clean back and forth for 30 seconds. Get all the crusties off, and it's sutured in. Back and forth. It's not gonna move like that, I promise you. Back and forth. Okay, 30 seconds. I know that wasn't 30 seconds according to the video Brooklyn's gonna post, but we're gonna pretend, okay? So you're gonna drop this, not on your sterile field, right? You're going to let it dry. At the hospital, they have these cute little circle things that are antimicrobial circles. All you do is lift up this and it'll slide right on top. It's a little circle. The nurse will do it with you, I promise. It'll just sit right on there. It kills the germs around the insertion spot. So it's gonna be there. And then you're gonna take your dressing. And then in your window, you want the opening, right? Does that make sense to you? Push it down, get a good seal. I have a little wrinkle. I posted a video so you guys could see how one's actually inserted at the bedside by a physician. One of these triple lemon catheters.
That circle wouldn't stay
Yeah,
on there though, would it?
Yep, the circle
The
stays.
circle does stay up
The
on
circle
there.
stays. It's a little antimicrobial disc. It just slips right on top.
Okay.
I couldn't even find a video with one, but because I want to. Okay. Beautiful. Does that make sense? And now, after you have it sealed, you can take his mask off, your mask off, your gloves off. Well, you take your gloves, then your mask, because I took one of my. Your gloves and your mask. Don't cough on your patient. Does that make sense to everybody? And if you're gonna take this, I'm gonna leave this dressing on, but if you go to peel it, you just do hand hygiene. Put on clean gloves. And peel up, and away. So you would just peel it up, and away. Does that make sense? Does anybody have any questions about putting a dressing on and taking a dressing off? Shelby?
How often would it be changed?
Every 7 days, or as needed. So if it's bloody or half of this is peeled up, let's say half of it's like this, and you come in on your shift and it won't stick anymore, don't try to re-stick it, you're gonna change it then.
Can they can't usually shower with port.
They can't usually, they can shower with the port because it's not with the central line
They can't.
catheter.
Okay.
But I have had patients shower with them because they have them long term.
Yeah, and then there's
Not usually these, but more the PICC line. And the more of the PICC line, and the dressing's the same as the PICC line as the triple lumen catheter. Does that make sense to both of you, everybody? They'll wrap this with saran wrap. Have you guys all wrapped an IV in saran wrap? That's what you do with PICC line. They won't shower with a triple lumen catheter. Because sometimes
triple lumens are normally like short term.
yeah, short term, less than 6 weeks while they're in the ICU or hospital. God love nurses. I was a horrible nurse mom when I had my daughter in St. Louis. They said, day 2, we need to put a PICC line in your daughter because she's going to be here for like a month. Okay, there's nobody on duty that can do the PICC line. Go home, go to sleep, pray that the nurse, like a night nurse, can do it. Oh no, she called in sick. So 3 days we had a normal IV site, it was fine. Day 4, the nurse comes in, she's like, at like 10 a.m. I'm gonna put the PICC line in your daughter. Fine, like I'm fine, like we're good. 2 hours later, the PICC line is still not in. I'm like, what the heck? So I went to lunch, I'm like, maybe I'm just putting too much pressure on this one. Like, obviously I'm a nurse, that probably is, you know what I mean, more pressure when you take. I think when I take care of somebody's like family member that's a nurse, they're watching every single move you do. So she finally got it. So little kids say they're gonna need blood transfusions for long term, like they're a neonate, they're really sick, maybe their liver's not working, they're gonna need blood transfusions. You're gonna give them maybe a PICC line. Tomorrow, somebody going tomorrow for cataract surgery, do they need a PICC line or a central line or a port? No. Some people are really hard sticks, and they go ahead and get a portacath placed. They're my favorite patient. Now, does everybody who's a hard stick need a portacath placed? No. If you all, hopefully none of us get cancer and they find a cure tomorrow, we won't all need portacaths, but if you go get chemotherapy treatment, I highly encourage you all to get a portacath. It's a minor procedure. It is surgery. They put you to sleep, numb your skin, cut you a little open, they can puncture your lung, you develop a pneumothorax, we have bigger problems. So yes, it is a surgery. But to get your chemotherapy through a portacath and not risk an extravasation we learned about last semester, the best thing ever. And they also have power ports now that have it's a triangle and it has 3 little bumps on it, so they can inject CT dye through it. So it's amazing. Does that make sense? Mm-hmm. So we're not gonna have cancer. And when to take it out, they do it in the office. They just cut the skin and pull it. They numb the skin and pull it straight out. So the bad part is they can also get infected too. Okay, so now we're gonna draw some blood. I'm gonna put on clean gloves. I'm going to perform hand hygiene for 30 seconds, then put on clean gloves. And my little friendly kit didn't come with alcohol, so I'm going to go grab some. Okay, so we're gonna have kit's no longer sterile. It may become sterile again. So we're gonna have our syringes. And this says to push on the plunger with the tip catch attached to break the seal, so you don't squirt water all over. See, it makes a lot. So put your caps back on because we don't want to contaminate. Or if you take your caps off, you're going to sit it on an alcohol swab. Good job, Crystal. Okay, so we're gonna come over here. We're gonna get my alcohol prep pad. We're gonna draw blood from the distal line. I'm using the Proxwell, but we're gonna pretend it's this. They're all gonna have these ports on, these little blue extra hubs, I call them. At the hospital, they call them CLC, like 3,000 or 5,000. So we're gonna attach this. You don't have to lock these little extra things, because these hold positive pressure. So you're going to pull back. You're going to see invisible blood. And they can be sitting up now. When you draw your blood, they can be sitting up. They don't have to be laying flat. And you're going to use what's called the push-pause method. So you're going to push a little, pause, push a little, pause, push, pause, push, pause, push, pause. You're going to draw back 10 mLs of blood. And that blood is diluted with saline. So do we want to give that to the lab lady to put in the vials? No, because their hemoglobin's going to be about 4. So you're going to discard this. So just sit it away. You're going to take your new syringe. And it's still sterile. You didn't touch it with anything else. If you want to swab it again, great. If not, you're fine. You're going to attach your syringe, draw back the desired amount of blood you need. Now, if you're doing like a CBC, CMP, which is like your BU and creatinine, potassium, and liver enzymes, and a PT-INR, you need about 15 mils of blood. So you're going to have to bring a couple syringes with you. You're going to hand that to the lab lady or sit it down yourself and put it in the vials with a needle. And then when you're done, you're going to flush it with 10 mils of saline using the push-pause method. Does that make sense? Does anybody have questions about that? Nope, okay.
Do you just use like regular 10 ml syringes?
Yeah, just the regular 10 ml syringes.
Do you put it in the vial before or after you flush it?
I go ahead and flush it because I think if this is just me being a nurse, don't put this as the NCLEX question. But I don't think this will I mean, I'll tell you. I don't think that'll be a trick question. Like, did you put it in the vial first or do you flush it? I go ahead and flush it because I'd be the one that put it in the vial, then left the room to go send it to lab, and then left blood in the line. Then it'd be included forever. So, lucky for me, I won't hopefully do that. I'm gonna save our little patient over here and put on the distal for my next friends. Okay. Any questions about that? Okay. And then I'm gonna take my gloves off and perform amazing hand hygiene, right?
So recap, hand hygiene, clean gloves, use your
10 ml syringe.
way to clean the hub, pull back to see blood return,
Yep.
pause method with
And I pull back a little to see blood. Like, okay, so I cleaned it with alcohol. And then this is my invisible saline. I have gloves on. I pull back a little first to see if I get blood. Sometimes you might not get blood right away. Don't choose this on NCLEX. I'll push like 2 mils and then pull back again. Sometimes there might be like a little blood clot sitting. It's not like it's like a minute blood clot. Sit like a little piece of blood just sitting there. Just needs to break off. So I might push a little first and then pull back. Your nurse might tell you to do that in real life. And then blood will come. Okay. If you can't get blood to come, you can have them, hey, go through this door.
Okay.
Have them raise their arm or turn their head while you're pulling back, and blood will start to come then. Sometimes they're positional, how their neck, if it's laying on a bone or their clavicle. Okay?
Right.
Any questions?
But then you would just draw after you get the blood return, you would just draw 10 mils, discard it, and then
Discard,
draw
so push
however
pause,
much you need, and then flush it.
push pause, draw back your diluted 10, discard. I sit it far from me. like I said, as far as I can reach. And then you're gonna take your new syringe, pull back the amount of, it won't come like that. Your blood's not gonna come like that, I promise you. It won't. You'll be like here, like going really slow. And then sometimes it'll come, and then you stop.
I'm gonna do that during my check off. You're like, oh, it stopped, hold on.
Give this to the lab lady, or I sit that close to me, and then you're gonna flush with your 10 mils of saline. Sound good? Okay, now we're gonna come over to this other side of our patient and access this portacap. So you're gonna use the same kit when you come practice. You're gonna use the same kit, but for today's sake, I'm not going to, so we can all visualize this. Now, when you go to the cancer center, they may not make you wear a mask. They may not make your patient wear a mask. But at Hannibal Regional Hospital, you're going to wear a mask.
Wait, so do you need masks for drawing blood too?
No.
Just for the dressing?
Just the dressing changes and accessing the port. Because when you think of chemotherapy patients, the cancer center is somewhere they go every day, so it's a normal routine for them. So some cancer centers don't make the patients wear the mask, they just have them turn their head. So, but they may make you wear the mask, they may not. I'm not gonna say for sure, okay? If you have a cold, definitely wear the mask that day. So you're gonna say, okay, Mr. Smith, we're gonna access your port today. Now what I like to do, now if you look at the other guy, he's over here. He's been stuck a lot, okay? This one, not so much. So you come over here and you feel for the pores. Like I said, they have these things called power ports now that have three little, it's like a triangle and it has three little bumps on them. They're called power ports. They're pretty amazing. But they don't like to share blood. I don't know why. So take your chance. If you get lung cancer, get a power port because you have to have lots of CAT scans. Okay, so I feel it. You don't have to feel it for that one. Once you feel it, you stay away. And this is the part where you need a clean hand and a dirty hand. Okay, so I'm going to perform hand hygiene. Oh, and joint commission is supposed to be at the hospital sometime soon. It'll obviously be next week because we're back as students there. So, if our patient has C. diff, do we use the hand sanitizer? No, we use soap and water. And I'm really guilty. I do not wipe everything down between room to room. So make sure if you take down the room, like the vital signs machine, you wipe it down. I'm really guilty.
Like whether or not they have C. diff or just if
Yeah,
they have
any
C. diff?
patient.
Okay.
You're supposed to wipe everything down you take in. You're supposed to wipe it down. I know that's,
Like top of linen carts too?
I think so, probably.
Like, the whole.
The whole
I
thing.
do
Never
too.
wipe the linen cards.
You know, let me just tell you,
That's
I
why
don't,
we just keep the linen cart outside the door.
yeah, just
Yeah.
park it outside the door. You know what I do? I just take the linen bag in myself and sit it on the little short chairs and open it up. But that's just me. Okay. So when you go to open these, if you hold it like that, I'm not gonna like take off because it'll fold back in 1,000 times. He's got his mask on. Mr. Smith, I'm gonna access your port today. Usually most time at the cancer center, they're just sitting upright in the chair when you access their port. So this cute little towel it comes with, it's cute. And I get really nervous sometimes, so I'm like, I'm gonna touch your port again. And I say, okay, now, key step right here. No, I think I threw my needle away. I'll take that out of the trash in a minute. This is the most important step. Before you put on your sterile gloves, you're going to open up your needle and drop it onto your sterile field. gonna scoop your other glove on. Okay. So, we have to prime our little port needle or we'll give our patient an air embolism. And what will happen to him, Marcy? Yeah. You betcha, they die. So you're gonna prime this and you're just gonna watch a little water come out. Now, at this point, some people take the needle off now and sit it on their sterile field. I loosen it. You're gonna clean back and forth with your chlorhexidine. Chlorhexidine kills for days, alcohol kills for hours. Seconds, okay. Try that really good. Mr. Smith, your chest is really wet, but we're gonna wait till it dries all the way. I'm not going to fan it. Now, I put my chlorhexidine on my sterile field. You all just saw that. But now I know that from there, and my new 1-inch border starts an inch in. Does that all make sense to you?
Mm-hmm.
Does that confuse you that I did that? Sorry if it does.
If you had a trash can next to you.
I could have used it there. I could have threw it on the floor, yeah. Okay. Now I'm going to take this off. And now my left hand, shoot, I'm right-handed, sorry. Sorry, Evie and Gary. You're going to tell your patient to take a deep breath. I will have my back to my sterile field because that would fail you in life. But actually, after this, we're done with the sterile field. You're going to say, Mr. Smith, take a deep breath. 1, 2, 3. You go straight in. You're going to come over here and pull back. Oh, I see great blood. You're going to use the push-pause method. Okay. Mr. Smith. We're going to use the push-pause method. Mr. Smith is really hard to push today. And once you get that all pushed in, you're going to clamp it. So more of you can see, sorry. Some of these needles are 1.5 inch, so they're not going to go 100% flush with the skin. So typically on everybody in here, we're going to use a 1-inch needle. If Mr. Smith weighed 400 pounds, you'd want to use a 1.5 inch. Most of them are 1 inches, but I think we have a couple that I got flush. So now we are done with the sterile part. Okay? So we're going to put this at the hospital. When you do the tegaderm, the windows, it's pretty much all clear at the hospital. It's not this tiny. So you're going to take it and you're going to push your tegaderm down and get a good seal. How do we know if he has fluid volume overload?
Listen to the lungs.
Oh, listen to their lungs. What kind of sounds might we hear?
Shackles.
Good job. If we don't have a good seal, like at the top maybe, we could take these pieces of tape and they rip, and we can add it. So you have an extra good seal.
Do you have to change gloves after you do the needle before the tegaderm?
No.
You can still use.
Yeah,
are you
they're
wearing-
still
are you supposed to be, you still wearing sterile gloves?
they're still sterile, but they're not contained. I mean, they're just clean.
Okay.
Once you break your sterile field, they're still clean. Okay. There we go. How's my friend look? He looks pretty good. Okay. We're gonna take off his mask, take off your gloves, take off your mask glass, and perform hand hygiene. Good job. and I clamped this because I don't have a adapter to put on this. Air could, if this wasn't clamped, air could get in and then he could die. So we're gonna make sure it's clamped. Okay. Now, when we go to get blood on this patient, we're gonna do it the same way. We're just gonna talk it through, okay? So, with portacath, sorry, we can use heparin. Does anybody know the dose of heparin we give when we give it sub-Q?
5,000 units.
5,000 units per how many mils?
I don't know.
1. Good job. But when we do heparin through a portacath, sometimes the order heparin to be flushed, it helps prevent clotting at the insertion point. So, they'll order heparin and they order 100 units per mil. So the unit that's like, it's usually yellow, the syringe is labeled yellow. So, and you usually give 3 to 5 mils, so 300 to 500 units of heparin after each, like once a day, or when you go to de-access the portacath. So we'll talk about how to de-access a portacath in a minute. Okay, we're gonna talk through the steps of giving blood. So, first thing we're gonna do is flush with 10 mils of saline. We're going to draw back 10 mils of diluted blood, right? After we scrub the hub with alcohol, then we'll flush with 10. Draw back that 10 mils. We're going to waste it, right? Not give it to the lab person. And then we're gonna draw back the desired amount of blood ordered. And then, let me go over this. Okay, we're gonna flush with 10 mils of saline using the push-pause method. Clamp it, because we don't want them to get an air embolism. Actually, don't clamp it. Draw back your 10 mils of diluted blood. Clamp it. Give this to the lab lady. No, she's gonna just throw that away. You're going to get your new syringe, attach it, draw back the desired amount of blood.
Isn't it clamped?
I unclamped it, sorry.
Okay.
Clamp it before you disconnect your syringe. Give this to the lab lady, because that's the right amount of blood they need for their testing. Then you're going to attach your 10 ml syringe of saline. And flush that using the push-pause method, and use all 10 mils. Then you're going to clamp it. And send the lab lady on her way, and you're gonna make sure your patient's okay. What if our patient had normal saline going, and they only had this port? Guess what you're gonna have to do? Approximately for 5 minutes, you're gonna turn off all the fluids and wait. And then draw your blood specimen. And that's with all of these central venous access devices. Does that make sense? Because then you don't get saline.
You said wait 5 minutes?
5 minutes.
Do you still do the normal like push?
What'd you say?
Do you still like flush it like you would normally before and after you just had saline running?
Yeah, or you could, I flush it with saline and then I hook up the saline after I get the blood. I just like to be extra
But you'd still like do it before drawing.
Oh yeah, just before drawing it, yeah. Okay, now it's time for Mr. Smith to leave the cancer center. He's had a great day. When you de-access a port, you can have your patient lay in Trendelenburg. At the hospital you should. At the cancer center, I'm not sure what they do. It's probably patient preference. We're not using sterile technique, so we're gonna perform hand hygiene and apply clean gloves. And we're gonna have a piece of tape and gauze ready. Okay, Mr. Smith, we're gonna de-access your port. He's like, lovely. Okay, and I'm gonna pull this tape all off in a straight. Now, with a port, I pull all the tape to the middle. You could pull it up and away. It's gonna come off really easy right now because it's been stuck for 10 minutes. Does that make sense to you guys? In real life, it's all gonna end up right here. I promise you. Okay, so I'm gonna take my gauze. I'm gonna tell Mr. Smith to take a deep breath. Take a deep breath. And I pulled it straight out. I'll show you a cool trick in a minute, but some days I don't think it's always the coolest trick. Okay. And you've applied a Band-Aid and he's happy to go home and he walks away. Dee-dee-dee-dee. Okay, with this, when you take this off, I'm gonna take all this tape off. Sometimes there's a whole bunch of tape here and it's hard to get the top of this access device, but if you hold you're supposed to hold this flush, I'm poking them here. You're supposed to hold this flush with the skin and it'll pull this straight back and lock. But when you have a wad of tape up here, it's really hard to get your fingers and tape separated, so I just pull it straight out. But you should hold it here and pull it straight back. Does that make sense to you guys, or am I confusing you more?
What's it gonna be on the quiz?
This isn't, but just when you get checked off.
Alright.
If you hold it this way, I'm not gonna take off. If you have all the tape and just pull it straight out and drop it in the sharps.
Okay.
I just don't want you to stab yourself. Does everybody understand this?
Yeah.
Okay. What questions do you have? So for check off, you're going to, this is how it's really gonna go. I'm gonna say, okay, now we're gonna take off chest of the chest central. He needs his dressing change. And you're gonna peel off the dressing up and away and take it off with clean or sterile gloves. Clean. But you're both gonna have a
Mask.
good job. And then I'm gonna say, time out. He no longer has this. You now need to access his portacath. You're gonna come over here, use your beautiful sterile kit, and access the port. And then you're going to put your dressing on, and you're actually gonna put your dressing on over here, and then you're gonna de-access the portacath.
Guess I'll do it okay?
I think so.
Alright,
Yeah.
alright, good job.
Okay, well, I'll be there in a minute.
Oh, that's fine. Are you gonna take a break?
I will be done,
Okay, alright, sounds good.
so.
Wait, so are we have to draw blood? Did you say that?
Oh, yeah, you gotta draw blood too. I make you do that at the end though. Dr. Riggs, when people walk in the room, I like lose my train of thought. I just make you draw blood at the end, cause that's what you do. You're gonna put everything stabilized and then you're gonna draw blood.
So for the central line, we just have to remove the dressing, or?
And you're gonna put the new dressing on,
Okay,
but we're gonna pause and switch. I make you switch over here real quick.
okay,
So we don't like waste two kits.
okay, yeah.
So. I say, oh, he lost the central line, it fell out. And then I say, oh, now he has a port. We're gonna access the port. Any questions? Okay. So there's videos on people getting a central line put in, and it's really neat to see. Nowadays you have to wear the whole sterile gown, the whole hat, and sterile. You don't have to wear sterile gloves. So it's kind of a pain to go watch one, but it is neat. So I posted a video and posted a pic getting placed. So
Don't lock your knees.
Yes.
There was a high school student that came in. It was like one of the job shadows. It wasn't Landry. It was like after Landry had come. And she,
oh, come in. You're gonna go through those doors. You're fine.
we were doing a central line on a patient who was pretty much nonverbal except who just screamed. And he needed a central line, so they were in there and they were like, hey, you wanna watch? She's like, yeah, sure, that's great. And then I'm out at the desk and I hear a big boom and I feel the floor like vibrate. I'm like, shoot. somebody just fell. So I'm like counting mentally in my brain, like ventilated. No. We have a student. So I ran to the door, and sure enough, she was just laying flat on the door or on the floor. Awful. She was so embarrassed, and she was 17, so we had to call her parents. Make sure they didn't want to get her like checked out so young.
You know, go in there though?
I think so. I haven't gotten the approval exemption yet, so.
Well, it took us over an hour because he got it.
Okay,
And then
so you guys are free to go.
like,
They said that